Good evening, how are you? Wish you are fine. I'm Dr. Bassem, I'm plastic surgeon. I want to speak about Xeomin versus Botox, differences, similarities, and which is better for you. Cosmetic medicine has popularized the use of injectables for promoting smoother, younger looking skin. Xeomin and Botox are two injectable treatments that are commonly used to reduce the appearance of fine lines and wrinkles. This is a box of Xeomin, okay, and this is a box of Botox, okay. Xeomin and Botox contain botulinum toxin type A, a neurotoxin produced by a bacterial species called Clostridium botulinum. This neurotoxin works by blocking neuromuscular signals to relax targeted muscles at the injection site. Despite the fact that these treatments contain the same active ingredients, they have some differences in how they are used and formulated. What are the main differences between Xeomin and Botox? The main difference between Xeomin and Botox is that Xeomin contains a naked form of botulinum toxin. Unlike Botox, which contains accessory proteins, Xeomin is designed to deliver the toxin without any protein additives. This purified structure may help prevent antibody resistance, a growing problem that has been seen with injections administered over time. Xeomin, which is manufactured by Merck Pharma, can be stored at room temperature in a refrigerator or in a freezer before using. Botox is manufactured by Allergan and it needs to be stored in a refrigerator prior to use. Main differences between Xeomin and Botox. The drug class, according to Xeomin, it is botulinum toxin type A. The same is for Botox, botulinum toxin type A. Brand generic status: Xeomin brand name only and Botox brand name only. What is the generic name? Uh, it is for Xeomin in botulinum toxin A, and according to the Botox, it is on botulinum toxin A. What forms does the drug come in? It comes into injection, powder for solution. It is related to the Xeomin, and it is before it was injection powder for solution, and it has become as a gas for Botox Allergan. What is the standard dosage? For Xeomin lines and wrinkles, it is 20 units divided into 4 sites, 4 units per injection. According to Xeomin, lines and wrinkles, 20 units divided into 5 sites, 4 units per injection. How long is the typical treatment? Treatment may need to be repeated every 3 to 4 months according to the Xeomin, and treatment may need to be repeated every 3 to 4 months. The same. Who typically uses the medication? Adults over 18 years old and older, and according to the Botox, it is adults over 18 years old and older. Conditions treated by Xeomin and Botox. Xeomin was FDA approved in 2010 to not only treat glabellar lines or fine lines, but also a number of other conditions. As a cosmetic treatment, Xeomin can help temporarily get rid of frown lines, forehead lines, and crow's feet around the eyes. Xeomin can also treat excessive drooling and salivation, chronic cyuria, as well as abnormal muscle contractions of the neck, cervical dystonia, eyelids, blepharospasm, or limb spasticity. Uh, BOTOX was initially FDA approved in 1985. It can be used for cosmetic treatments as well as other conditions such as an overactive bladder, urinary incontinence, and excessive sweating. It is also approved to treat headache and migraines. Like Xeomin, Botox can treat muscle spasms and abnormal contractions of the limbs, neck, and eyelids. According to the condition of glabellar lines, Xeomin yes, Botox yes, excessive drooling salivation, Xeomin yes, Botox off-label, abnormal muscle contractions of the neck muscles, eyelids, or limbs, both of them are yes. Headaches and migraines, Xeomin off-label, but Botox allergen, yes. Overactive bladder, Xeomin off-label, and but Botox, yes. Urinary incontinence due to a neurological disorder, Xeomin out of label, off-label, and Xeomin, Botox allergen, yes. Excessive sweating, Xeomin, no. Allergen or Botox, yes. Is Xeomin or Botox more effective? For cosmetic purposes, Xeomin and Botox are effective treatments. They are both relatively convenient treatments to administer compared to plastic surgery and other invasive procedures. Both Xeomin and Botox start working once they are injected into the muscle. For aesthetic purposes, their full effect may not be seen until 7 to 14 days after injection or longer. According to one randomized double-blind study, Xeomin was found to work faster and last longer than Botox. The study was which assessed 180 people over 6 months found that more women experienced greater effects compared to men. This sport, abobotulinium toxin, another botulinum toxin injections, was also included in the study and fared on a similar level with Botox when compared to Xeomin. The Journal of Dermatology Surgery ran a double-blind clinical trial comparing the active ingredients of Xeomin and Botox. The trial includes 250 women who either received 20 units of Xeomin or 20 units of Botox. According to this study, both toxin injections showed similar effectiveness after 4 months. Aside from the fact that these injections work in identical ways, they must also be administered by a licensed provider or medical doctor, such as a dermatologist or plastic surgeon. Consult your provider to determine which option is better for you. Coverage and cost comparison of Xeomin versus Botox. Unfortunately, there are no generic versions of Xeomin or Botox available. This is because regularity laws apply differently to these drugs since they are considered biologic drugs. Although they may still be expensive, the good news is that Xeomin and Botox are relatively similar in price. The average retail cost of either drug can be more than $1,000 or more for a vial. It means nearly 3,770 reals. Okay, it is nearly $1,000 or more for a vial. Okay, this is the price if you compare it in real. However, since you would be getting treatment administered at med spa or doctor's office, your treatment session may be priced differently. Medicare and most insurance plans don't cover Xeomin or Botox. With a single care discount card for Xeomin or Botox, the cash price can be lowered significantly depending on the pharmacy you use. Xeomin could cost less than $300 and Botox just more than $600. Typically covered by insurance, Xeomin, both of them are not covered. Typically covered by Medicare, both of them are not covered. Standard dosage, it is 20 units both, or 100 unit for the vial. Typical Medicare copay, we will not speak about the prices more than I mentioned. Common side effects of Xeomin versus Botox. The most common side effects with Xeomin and Botox include headache and injection site reactions. After receiving an injection, you may experience minor redness, pain, or swelling around the area. Other side effects may include dry mouth, dry eyes, muscle weakness, and respiratory tract infection. More serious side effects may include hypersensitivity or allergic reactions. If you experience difficulty breathing or severe rash, seek medical attention immediately. Side effects applicable headache with Xeomin. The frequency is 5%, and according to the Botox, nearly the same the frequency. Dry mouth, according to the Xeomin, yes, nearly 400. According to the Botox, yes, but not reported. According to the dry eyes, yes, with a frequency of 3%. Botox, yes, but not reported. According to muscle weakness, applicable, yes, 7%. According to Botox, 4%. Respiratory tract infection, according to the Botox, yes, with 2%. According to the Botox, yes, to 2%. This may not be complete list. Consult your doctor or pharmacist for possible side effects. Drug interactions of Xeomin versus Botox. Xeomin and Botox should be avoided with other medications that have similar effects. These medications include aminoglycosides, anticholinergic, curar, alkaloids, and muscle relaxants. Taking these drugs while getting a Xeomin or Botox injection could lead to increased side effects. Xeomin and Botox should also be avoided with other botulinum toxin products. Receiving other toxin injections without a long enough interval between sessions can worsen side effects such as muscle weakness. According to the interactions with gentamicin, tobramycin, streptomycin, drug class aminoglycosides, both of them, Xeomin and Botox. Atropine, benzotropine, clidinium, it is anticholinergic, both of them, yes. Tobocorarine, alcoronium, Corer alkaloids, both of them, yes. And tizanidine and tinazidine and other cyclobenzoparine muscle relaxants, both of them are yes. This may not be a complete list of all possible drug interactions. Consult your doctor with all the medications you may be taking. Warnings of Xeomin and Botox. Botulinum toxin has been known to spread from the injection areas and cause adverse effects associated with the toxin. These effects include difficulty swallowing or breathing. In severe cases, botulinum toxin can cause paralysis, respiratory failure, and even I don't want to speak about it because in general we give low doses of Botox, but they say about some of the studies says about botulinum toxin can cause paralysis, respiratory failure, and even death. While the risk may be higher in children, these effects are still possible in adults. It's important to get Xeomin and Botox injected by a licensed professional because of the possibility of adverse effects. These medications need to be injected properly and in the correct dosage. Frequently asked questions about Xeomin versus Botox. What's the Xeomin? Xeomin is the brand name is the brand name for incobotulinum toxin A injections. Xeomin is often used to reduce fine lines and wrinkles. Injections should be given every 3 to 4 months for consistent results. What's Botox? Botox is a commonly used botulinum toxin injection for cosmetic purposes. Botox contain uh, uh, on a botulinum toxin A and is injected every 3 to 4 months. It is also FDA approved for headache and migraines as well as other conditions. Are Xeomin and Botox are the same? Xeomin and Botox both contain botulinum toxin. This is the Xeomin. This is the Botox. Xeomin and Botox both contain botulinum toxin, but they are not the same drug. Unlike Botox, Xeomin contains a different form of botulinum toxin with no accessory proteins. Xeomin also has less storage restrictions, meaning it doesn't have to be refrigerated before use. Is Xeomin or Botox better? Xeomin and Botox both work to smooth the skin and get rid of frown lines, while they are both comparable in effectiveness. Some studies have shown that Xeomin has a quicker onset of action and a longer duration. I don't know about this. Any question mark? The best treatment is the one that your practitioner recommends for your specific conditions. Can I use Xeomin or Botox while pregnant? Since Xeomin and Botox are usually localized treatments, they have a low risk of getting into the bloodstream. That being said, there is still a risk of fatal harm, especially if large amounts are administered. Consult your healthcare provider if you are pregnant and seeking treatments with Xeomin or Botox. According to me, it is contraindication. Can I use Xeomin or Botox with alcohol? Alcohol has blood thinning properties which may worsen the side effects of some drugs. It's usually recommended to hold off on drinking alcohol for at least 24 hours before your Xeomin or Botox sessions. Otherwise, alcohol may increase the risk of bruising or swelling around the treatment area, which lasts longer. Xeomin or Botox. Botulinum toxin injections usually last at least 3 months. Some people may experience effects that last up to 4 to 5 months or longer depending on the area treated and the dose injected. According to some studies, women who received Xeomin for glabellar lines reported a longer lasting effects compared to Botox. What is the average cost of Xeomin? The cost of Xeomin depends on where you purchase it from. If you are buying a vial from the pharmacy, the average retail price can be around $1,000 with a Xeomin discount card. The price can be lowered to under $300 for a 100 unit vial. You would, however, most likely receive Xeomin treatments for a med spa or dermatology clinic. Since insurance doesn't typically cover Xeomin injections, the price will vary based on where you go. How fast does Xeomin work? Xeomin starts working right after it's injected into the target facial muscles. However, the visible effects of Xeomin treatments may not be seen for at least 7 days after administration. It's best to follow up your provider 7 to 14 days after your treatments to evaluate the result. This was a summary about Xeomin or uh, Botox allergen. According to me, I have an experience more with this, more than the Xeomin, more and more. According to me, I will try to make a demo about it, and during this demo, I will have an idea about it. Okay, that was a summary about Xeomin and Botox. Wish that you have uh, gotten good ideas and good information about both of them. I'm Dr. Bassem. Please make like, share, subscribe, and activate bell ring.